Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Glad that you could join us today. I'm talking today with Dr. Richard Friedberg. He's a pathologist, and he's here to talk with us about the field of pathology in general and the College of American Pathologists. Welcome to Health Professional Radio, Dr. Friedberg.
Thank you very much. Appreciate the opportunity to talk.
Glad that you could join us. What is this College of American Pathologists?
So the College of American Pathologists, we always refer to it as CAP. It's actually the second largest medical association in the country, and we have two basic functions. Number one is that we represent our 18,000 or so member physicians, advocate for their interests and the issues that will help them help patients. And secondly, we help make sure that laboratories really around the world operate at the highest levels. So we accredit over 8,000 laboratories international. Created checklists that have almost 3,000 items in the checklist to make sure that are being done at all these laboratories. And we conduct what's called proficiency testing, which are tests on unknown samples that a laboratory and the people working in the laboratory and the patients benefiting from that laboratory can gauge the results and the processes. And we do that in almost 20,000 laboratories around the world. Our tests in our laboratories are among the most rigorous in the world, and in the end, that's best for the patients, making sure they're getting the best, clearest, and most actionable information for their health.
So you mentioned helping pathologists, thereby helping patients.
So pathologists are physicians that work in the laboratory. And we are the underpinning. We're of so much of the underpinning of all of healthcare. So everybody who's been to see a doctor just about has had samples sent to a laboratory. It might be a tube of blood, it might be a small piece of tissue or a bigger piece of tissue out from the operating room, biopsies. And pathologists are the physicians, the medical doctors who are trained in the medicine and the science, both sides of it, to examine those specimens and collaborate with your other physicians, your primary care doctor, your specialist, your surgeon perhaps, to collectively decide on the best course of action for your health. Something on the order of 70% of medical decisions in the healthcare world are based on the findings that a pathologist is involved in, either in the tissue side of the laboratory or in the laboratory or the blood side of the laboratory. And pathologists diagnose almost 100% of cancers. Most people think of pathologists as medical examiners who conduct autopsies, and a small percentage of us do that, but the vast, vast majority of pathologists are squarely in the center of your healthcare team, helping you to ensure you get the right diagnosis the first time and with the best possible treatment. So we are where the science comes into medicine, much of it in the laboratory.
Now, you lead a group of more than 20 pathologists and a regional reference laboratory, as you said, providing some pretty exclusive diagnostic services to a number of hospitals. Talk about your role there at Baystate Health.
So at Baystate Health, I serve as chair of the Department of Pathology and medical director of Baystate Reference Laboratories. And Baystate is a multiple hospital system in western Massachusetts, and we provide all the diagnostic services, the laboratory services for all those hospitals. So my group of 22, 23 pathologists and something on the order of 500 or 600, 700 employees altogether run all the laboratories, do the diagnostic testing for all the patients, inpatient and outpatients, as well as private patients that are coming to Baystate Health facilities, as well as unrelated hospitals and doctors in the area.
When talking about pathologists and their role in healthcare, what about the role of pathologists in security issues, such as screening for employment or maybe within the criminal justice system? Are the standards that the College of American Pathologists abide by, are those the same standards across pathology, or does it vary based on where pathology is being practiced?
So there are a set of significant federal and state regulations around laboratories and diagnostics together. The fundamental rules at the federal level are called CLIA, for Clinical Laboratory Improvement Act of 1988. It's been amended many times over the years. And all facilities that bill patients, bill Medicare at least, have to be CLIA accredited. And the vast majority of the high-level labs in the United States that are accredited by CLIA and by CAP. So if you're accredited by CAP, by us, then you meet the CLIA requirements. The standards in other places can vary, and I'm not sure if I can tell you exactly who is and who isn't CAP accredited, but the vast majority of the major laboratories in the U.S., the vast majority, are CAP accredited, and those are the highest standards that are available. But it's all predicated on the federal regulations under CLIA, CLIA, Clinical Laboratory Amendments.
As someone who's not constantly thinking about the pathology that's involved in my healthcare or anyone else's healthcare, to me, is you send a sample, you get it tested, you come back, your doctor says this, he says that or the other. As a pathologist, you talk about collaborating with physicians to ensure the best patient care. Some of us see a disconnect between the pathologist and the patient who's sitting talking with the physician. How does the College of American Pathologists get awareness to the patient that they are a vital part of their healthcare team?
Well, we are probably one of the most important unseen parts of the healthcare system. So patients, when they go to see a doctor, or if they're in a surgeon's office, or if they're in an operating room, often don't see when the pathologist is involved. We don't often meet the patients. Sometimes we do. I, for example, consult on fairly complex diagnostic situations, and I will go see patients at those times. Mm-hmm. But not all pathologists have that opportunity. And since we are the doctors who are trained in both the science of medicine as well as the art of medicine, and we end up explaining a lot of things and translating a lot of things for the primary caregivers. And mm-hmm. The primary caregivers, as you know, are often physicians, but increasingly they're also nurse practitioners and physician's assistants who need some additional understanding of the fundamental science. So the CAP is encouraging pathologists to become more visible in their healthcare systems, but it's rather unusual for patients to really know who their pathologist is. But if you look on a laboratory report, or if you look on a surgical pathology report, the pathologist involved in making those absolutely critical decisions about what's going to dictate your future health care, their name is on there. And if you think about it, as I said before, we make many of the diagnoses, putting the science from the various parts of the laboratory, anatomic, clinical, hematology, immunology, all that. We put all that together in our reports. And if the diagnosis is wrong, not much else matters, because so much triggers off of that diagnosis, including exactly the treatment you're going to get. So again, the pathologist is one of the most important parts of the healthcare system, and oddly enough, we're also one of the more invisible parts. And we're trying to do what we can to rectify that. But the problem is that there's a lot of patients and a lot of work, and we are a step or two away from the patient.
Now, where can our listeners get more information about the CAP, the College of American Pathologists, about the field of pathology in general, and a little bit about Baystate Health as well?
So, this is one of those wonderful situations where the web has just about everything you'd like to see. Mm-hmm. So the College of American Pathologists has a website at www.cap.org. And Baystate Health, my facility, also has its own website with plenty of information, at www.baystatehealth.org. And on these sites, you can find information geared towards the general public to explain who we are and what we do. And it's interesting when you think about pathologist and patient care, because we do get into so many different other areas which people often don't see. Many of you may recall Dr. Bennett Omalu, who is the subject of the movie Concussion, mm-hmm. who discovered chronic traumatic encephalopathy, the brain condition associated with concussions in football.
Yes.
And there's a pathologist who conducted Prince's autopsy and determined his cause of death. Mm-hmm. We are involved with educational activities against opioid use, because all the drug testing happens in our laboratories. Much of the drug testing happens in our laboratories. We're involved in overseeing blood centers, and so there are doctors, and there's one associated with Geisinger who's well documented how she saved over $1 million a year for her health system by improving the blood transfusion systems. We're involved in running the microbiology laboratories and making sure that doctors and providers of all stripes around the country are ordering the right tests to make sure patients get the right results as quickly as possible. And so if you think about how much of your health care is determined from samples on you that go somewhere else, they go to a black box, and a number or answers come back, that black box is us.
Well, some fascinating insights into the field of pathology. I thank you for sharing with us today, Doctor.
Thank you very much. Appreciate the time.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Richard Friedberg. He's been talking about the College of American Pathologists, or the CAP, and about the field of pathology in general. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.